Hi there, welcome back to my YouTube channel, and today we are going to talk about gingivitis. Starting our topic with introduction, gingivitis is the mildest and most common form of gum disease. It is characterized by inflammation of gingiva, that is the gum tissue surrounding the teeth. It is often the precursor to more severe periodontal diseases if left untreated. So that means if it is not treated at time, it can lead to periodontitis. Now let's talk about the causes of gingivitis. What are the causes? The first or the primary cause of gingivitis is poor oral hygiene, which allows plaque to accumulate on the teeth and gums. And the contributing factors of gingivitis include plaque formation, that is basically a sticky biofilm of bacteria and food particles found on the teeth. Then the tartar buildup is also the risk factor, contributing factor to the gingivitis. That is, when plaque is not removed, it hardens into tartar, which irritates the gum, and that's how it causes the gingivitis. Now let's talk about the risk factors of the gingivitis. Or the factors that increase the risk of gingivitis are smoking or chewing tobacco can increase the risk of gingivitis. Then hormonal changes during pregnancy, puberty, or menopause can also influence the uh, probability of gingivitis, and the chronic illness such as diabetes can also increase the risk of gingivitis, and certain medication like anticonvulsant and immunosuppressant also increase the risk of gingivitis, and poor nutrition, especially a deficiency in vitamin C, is a risk factor for gingivitis, and stress, which can weaken the immune response and can also increase the risk for gingivitis. Then genetic predisposition to gum diseases can also increase the risk of gingivitis. Now let's talk about the symptoms of gingivitis. It includes it are mostly unnoticed because it is not always painful until they reach the severe stages. So, however, common signs and symptoms include red swollen or tender gums, gums that bleed easily when brushing or flossing is the characteristic symptom for the gingivitis, and the receding gum pulling away from the teeth, making them look longer, can is also the symptom of gingivitis, and persistent bad breath, that is also called as halitosis, is indicative of gingivitis or some type of bacterial action going on in the mouth. And the soft spongy gums are also the presentation specific presentation for the gingivitis. Now let's talk about the stages of gingivitis. Stages of gingivitis are early stage of gum disease and is irreversible if treated promptly. So, if left untreated, gingivitis can progress to periodontitis and become cause bone and gum damage, that is eventually the tooth loss. So let's talk about the diagnosis of gingivitis. How we diagnose this? First, the dentist diagnoses gingivitis by examining the gum for the signs of redness, swelling, and bleeding. Then, measuring gum pocket depth with the periodontal probe is also the way to diagnose gingivitis. It is also if used to know if there is gingivitis or periodontitis. So, checking for tartar buildup and emulating oral hygiene practices is an important step for checking the gingivitis and risk factor for gingivitis. Now let's talk about the treatment for gingivitis. The treatment focus on reversing the inflammation and restoring the gum health. That is by doing professional dental cleaning, that is scaling, that remove plaque and tartar from above and below the gum line. Then polishing smooth the tooth surface to prevent further plaque accumulation. The other thing we can do in treatment is improving oral hygiene, that is by brushing twice a day with fluoride toothpaste and flossing daily to remove plaque from between the teeth, and using an antimicrobial mouthwash as recommended. And the third thing we do is lifestyle changes, that is quitting smoking or tobacco use also reduce the risk for gingivitis, and eating a regular balanced diet that is very rich in vitamin and minerals can also help with that, and regular dental checkups that are the routine visit to dentists that help prevent recurrence of gingivitis or help preventing the having of the gingivitis. So let's talk about the prevention of gingivitis. How can we prevent? It is largely preventable with good oral hygiene practices that include brush and flossing daily, avoiding sugar and acidic foods that can contribute to plaque formation, and using a soft bristle toothbrush and replacing it every 3 to 4 months. And also visit a dentist for the professional cleaning at least twice a year can really decrease the risk for the gingivitis. Now let's talk about the complications of gingivitis if left untreated. It can cause periodontitis, that is more advanced stage of gum disease. It can also cause tooth loss due to damage to the supporting bone and tissue of the tooth. It can also cause systemic health issues, that is chronic gum inflammation has been linked to heart disease, this like and diabetes, and adverse pregnancy outcomes are also associated to some extent with the um, chronic gingivitis and or chronic gum inflammation. So this was all about gingivitis, its fact, treatment, complications, causes, symptoms, and all of the things. If you like the video, don't forget to like, share, subscribe, and comment. Thank you for watching.